Hair is often seen as a symbol of youth, vitality, and overall well-being. So it's no surprise that many people, particularly men, are concerned about thinning hair and balding. Whether you're noticing your hairline recede or finding more hair in your comb, maintaining thick, healthy hair becomes a top priority. The good news is that there are steps you can take to help slow hair loss, strengthen existing hair, and potentially encourage regrowth. In this video, we'll dive into practical tips and solutions to keep your hair looking its best. Understanding hair loss, the causes. Before diving into solutions, it's important to understand what causes hair loss. Male pattern baldness, also known as androgenetic alopecia, is the most common cause of hair loss in men. This condition is largely genetic and is influenced by male hormones, particularly dihydrotestosterone, DHT. That is a byproduct of testosterone that shrinks hair follicles, resulting in thinner hair and eventually hair loss. Age, family history, and hormone changes all play a part in the likelihood of developing male pattern baldness. However, hair thinning and hair loss can also be caused by other factors such as poor diet, stress, harsh hair products, and even certain medical conditions. Understanding the underlying cause of your hair loss is crucial in determining the most effective treatments. Maintain a healthy diet. A well-balanced diet is essential for healthy hair. Just like your body needs the right nutrients to function properly, your hair needs them too. Poor nutrition can lead to hair thinning and even hair loss, so it's important to eat foods that nourish both your body and your hair. Vitamins and minerals like biotin, vitamin E, vitamin C, and zinc play a crucial role in maintaining hair health. Biotin in particular is often touted as the hair vitamin because it helps strengthen hair and prevent hair loss. Vitamin E is known for its antioxidant properties, promoting scalp health by improving blood circulation. Vitamin C is essential for collagen production, which is a vital component of healthy hair follicles. Zinc supports the oil glands around the hair follicles, ensuring proper hydration and reducing hair shedding. Incorporate more protein into your diet as well. Hair is made primarily of keratin, a type of protein. Protein-rich foods like eggs, fish, poultry, beans, and nuts help nourish hair from the inside out. Omega-3 fatty acids, found in fatty fish such as salmon and mackerel, also help to keep the scalp healthy by moisturizing the hair follicles. Additionally, iron is essential for maintaining thick hair. Low iron levels can lead to hair loss, so make sure you're eating iron-rich foods like spinach, red meat, and legumes. If you're worried about your diet not providing enough nutrients for your hair, consider talking to a healthcare provider about supplements. Gentle hair care practices. When it comes to keeping your hair thick and healthy, how you treat it matters just as much as what you put in your body. Harsh hair care practices can contribute to thinning and breakage, so it's essential to adopt gentle hair care routines. First, avoid washing your hair too often. Shampooing your hair every day strips it of its natural oils, which can lead to dryness and brittleness. Depending on your hair type, aim to wash your hair 2 to 3 times a week, or less if your hair tends to be on the dry side. Use a mild, sulfate-free shampoo that won't strip your hair of its natural oils. Over time, you'll notice your hair looking shinier and healthier. Conditioning your hair regularly is just as important as washing it. A good conditioner will help maintain moisture levels and prevent breakage. Focus on the ends of your hair, which tend to be the driest and most vulnerable to damage. Leave-in conditioners can also provide extra hydration and protection against heat styling. Be gentle when drying your hair too. Avoid rubbing your hair vigorously with a towel, as this can cause friction that leads to breakage. Instead, pat your hair dry gently or use a microfiber towel to absorb moisture. If you can, allow your hair to air dry, as blow drying can weaken the hair shaft over time. If you must use heat, make sure to apply a heat protectant spray to reduce the damage caused by styling tools. Reduce stress. Stress is one of the most significant factors contributing to hair loss. When you're under stress, your body produces more cortisol, a hormone that can lead to hair thinning. Stress can also trigger a condition known as telogen effluvium, where hair follicles prematurely enter the shedding phase of the growth cycle. This can result in noticeable hair thinning and hair loss. To keep your hair thick and healthy, it's important to manage stress effectively. Regular exercise is one of the best ways to reduce stress. Physical activity promotes the release of endorphins, which can improve mood and lower stress levels. Yoga and meditation are also effective stress-relieving activities that promote relaxation and balance in the body. Getting enough sleep is another critical component of stress management. Aim for 7 to 9 hours of sleep per night to allow your body to recover and regenerate. Lack of sleep can lead to increased stress and, as a result, further hair loss. Use the right hair products. The products you use on your hair can make a significant difference in its thickness and overall health. Choosing the wrong products can cause scalp irritation, dry out your hair, and even contribute to hair loss. Look for shampoos and conditioners that are specifically formulated for hair thinning or hair loss. These products often contain ingredients that help nourish and strengthen hair follicles. Look for products that contain caffeine, which has been shown to stimulate hair growth by increasing circulation to the scalp. Saw palmetto is another common ingredient in hair growth shampoos, as it blocks the effects of DHT on hair follicles. Other helpful ingredients include biotin, keratin, and vitamins B6 and B12. If you have dandruff or scalp conditions like psoriasis or seborrheic dermatitis, addressing these issues can also improve the health of your hair. Dandruff can cause inflammation and hinder hair growth, so using an anti-dandruff shampoo or treating your scalp condition with the help of a dermatologist can promote a healthier scalp environment. Consider hair loss treatments. If you've already started noticing thinning hair or a receding hairline, you may want to consider treatments designed to address hair loss. There are several options available, ranging from over-the-counter solutions to medical treatments. Minoxidil, commonly sold under the brand name Rogaine, is an FDA-approved treatment for hair loss. It works by stimulating hair follicles, encouraging hair regrowth, and slowing hair loss. Minoxidil is applied directly to the scalp and is available in both liquid and foam forms. It may take several months to see noticeable results, but consistent use can help maintain hair thickness. For men with more severe hair loss, finasteride Propecia is a prescription medication that works by blocking the production of DHT. By preventing the hormone from shrinking hair follicles, finasteride can slow or even reverse hair loss in some individuals. However, it's important to consult with a healthcare provider before starting any medication to ensure it's safe and appropriate for your needs. Hair transplants and other surgical solutions. For men experiencing significant hair loss or baldness, hair transplants offer a more permanent solution. A hair transplant involves moving hair follicles from one part of the scalp, typically the back or sides, to areas experiencing thinning or balding. The procedure is typically performed by a dermatologist or surgeon specializing in hair restoration. Hair transplants are not cheap, but they can yield long-lasting, natural-looking results. However, not everyone is a good candidate for hair transplants, so it's important to consult with a specialist to determine whether this treatment is right for you. Maintaining thick and healthy hair doesn't have to be complicated. By taking a few simple steps and incorporating the right habits into your daily routine, you can keep your hair looking full and healthy for years to come. A healthy diet, gentle hair care practices, stress management, and using the right products all play a critical role in preventing hair loss and encouraging growth. If necessary, consider treatments like minoxidil, finasteride, or hair transplants to address more severe hair loss. Regardless of your approach, the key to keeping your hair thick and healthy lies in consistency and making informed choices that work for your unique hair needs.